Good evening, everyone. Welcome to this live session on the latest advancements in hypertension treatment, focusing on renal denervation therapy. I'm your host, Maitri, and I'm thrilled to introduce our special guest today, Dr. Vivek, an expert in cardiology and hypertension. Dr. Vivek, thank you for joining us.
Hi Maitri, thank you so much for having me here on this platform. Today, definitely we are going to talk about something very interesting that's happening in the treatment of hypertension, that is high blood pressure. And it's a great pleasure to be here, and I'm ready to take your questions. Thank you.
To kick things off, let's begin by addressing the burden of hypertension. Can you tell our audience about the prevalence and significance of hypertension in today's world?
So, hypertension is, Maitri, a disease which is widely prevalent. And most of the time it is kind of say that we are not exactly aware how big the problem is. So by a rough estimate, you can say that in adults more than 40 years or more, about 1/3 of them would be having high blood pressure. The unfortunate aspect is that among all these patients who could be by a fair estimate could be around 1.8 billion people in the world, almost more than 2/3 or 50% are actually not aware that they are having high blood pressure. And by this, you can really imagine how big this problem is.
Thank you, Dr. Vivek, for highlighting the magnitude of this issue. Now, let's discuss blood pressure control. What percentage of patients with hypertension have good blood pressure control?
So actually, if you see, hypertension is like a silent disease. Most of the people don't have any problem until very late in the disease course or natural history of the disease. Interestingly, that if you see, as I said, that about more than 50% of the people above 40 years don't know that they are having hypertension. And the people who know that their blood pressure is high, almost 50% of the patient don't take any kind of a treatment, any medical therapy to maintain a good blood pressure. And if you come into your question that what percent of the patients who actually have a good BP control, so in the people who get treated, more than 50% of people don't have ideal blood pressure control. And this is very unfortunate thing, because we all know that high blood pressure causes heart attacks, it causes stroke, it can cause renal dysfunction, and it's like a package with all the cardiovascular disease that it has. So it's very important that the blood pressure in a hypertensive patient is adequately and properly controlled.
That's informative. Dr. Vivek, what are the reasons for non-ideal control of BP?
Okay, so blood pressure, you see in 95% cases, you can say that it's multifactorial. You don't know exactly what is causing high blood pressure. It can be genetic, familial, environmental, lifestyle, and mix of all of them. It's just in 5% of cases actually we know exact cause of blood pressure. So if you ask me that is hypertension or high blood pressure is curable, I will say that in 95% of cases it's not. It's just the 5% cases where you know exactly what is the reason. It could be a problem with the renal artery, it could be problem with certain hormonal diseases that can cause blood pressure. And if you treat the primary cause, the blood pressure can be treated. But in most of the patients, that is 95% of the patients, hypertension is a disease which is managed, that is, which we try to control. It's going to be there lifelong, so we have to make sure that these patients are treated for their life. Unfortunately, there is a lot of reasons why such patients, more than 50% of the patients don't have an ideal blood pressure control. The reason, I think the most important reason is inertia or resistance from the patient's side about taking medicines. There is a lot of reluctance of taking blood pressure treatment or tablets if they are advised. The problem is that in most of the patients, just one blood pressure medicine doesn't work. They need at least 2 or more medicines. And if you increase the tablets, there is lots of resistance from the patient that why we need to take multiple drugs. So it's very important that patients should be made to understand that your BP control should be ideal. Anything less than that is not adequate. If you need more than one drug to take or control your blood pressure, it's very important that you take that. Apart from that, there could be some genetic factors that could be related to progressively increasing high blood pressure, and that can cause that the drugs are not working. So there is a group of patients we call resistant hypertension whom even 3 or more medicines are not able to control blood pressure. So one is patient compliance. This is very important. Lack of lifestyle measures. This is very important. And some genetic or familial factors. You can largely say that why their blood pressure are not adequately controlled.
Now, let's dive deeper into the concept of resistant hypertension. What exactly is resistant hypertension and how big of a problem is it?
Maitri, this is actually a real problem. Unfortunately, by a rough estimate, about 1/3 to 1/4 of patients of blood pressure, they don't have their blood pressure controlled despite they've been very judiciously taking their medicines. That is, they take the drugs. If you advise them 3 or 4 drugs, they take it, but the blood pressures are not controlled adequately. What is ideal blood pressure control? Look, in a hypertensive patient, that the patient who is having high blood pressure, we need that the blood pressure should be in the range of less than 130, that is systolic, and 80 mmHg, that is diastolic. But still, if we extend the range, it should never be more than 140/90 mmHg. So, in a person or a patient whom the blood pressure is not controlled below 140/90 with 3 or more medicines, this is what clinically we call resistant hypertension. And these are the patients who are very high risk patients of having adverse cardiovascular events in near and long term future. So this is what is called resistant hypertension, that 3 or more medicines are not able to control the blood pressure adequately, and they compound about 1/3 or 1/4 of that is about roughly 20 to 30% of the patients of all among all hypertensive patients.
Thank you for explaining that, Dr. Vivek. Now, let's move on to the exciting part of our discussion, the latest advancements in hypertension treatment. What's new in the field of hypertension treatment?
So, after resistant hypertension, this becomes very, I can say that a reflex question. What to do for such patients? That as a doctor, as a physician, as a cardiologist, I am advising a medicine to treat blood pressure, and I am advising multiple medicines, and we are not able to control the blood pressure. And this is a very helpless situation for anybody, for a physician, for the patient. It's really a bad feeling. But thank God, I'll say that medical science is advancing as per the need of our body. The disease process, that is, that cardiovascular disease is ever increasing problem. And thankfully, medical science is doing its due. And we have lots of new things happening in the blood pressure control. And in that respect, one treatment that is available now in India, what we call is a renal denervation therapy. It's a very innovative and a very promising treatment for controlling blood pressures in patients whom the medicines are not working.
Thank you, Dr. Vivek. Can you please elaborate on the role of renal denervation therapy in hypertension treatment?
So, as I said that about 1/3 of our patients whom we are giving blood pressure medicines, they are not adequately controlled. despite them taking their medicines properly. And we also know that if we don't control the blood pressure adequately, it's going to have a very bad impact on the heart, on the brain and the kidneys of the patient. So in such patients, renal denervation therapy becomes a very promising therapy or tool to maintain an ideal blood pressure, or at least try to achieve an ideal blood pressure goal in such patients. So I see a great promise for RDN patient. I see a great promise of RDN, the short form of renal denervation therapy, in such patients whom we are actually not able to control the blood pressure.
Thank you for that explanation, Dr. Vivek. How does renal denervation therapy help in BP control?
It's very interesting that to think about that you do something related to the nerves of the kidney. Renal means kidney, and it works for control of blood pressure. For in that regard, just to make you understand, so blood pressure control is maintained by multiple levels. We have receptors in our body that sense the blood pressure, and they give the feedback to the brain. And from brain, there are nerves going around to our blood vessels, to our heart, and to the kidneys that help to regulate blood pressure. That is, suppose if somebody's blood pressure is low, the receptors in the body, basically the carotid receptors and the baroreceptors we call it, just to give you the medical term, they sense that the blood pressure is low, and they give this feedback to the brain, and from brain, the sympathetic system, the adrenaline system is stimulated. What it does, it stimulates the heart so that the force of pumping increases, the rate of pumping increases so that more blood goes in the system. It goes to the blood vessels, the feedback that helps to narrow the blood vessels so that there is a resistance and blood pressure will increase. And the most important role is kidneys. The nerve inputs to the kidneys, what it does is that it stimulates the kidney to release very important hormones that is like the main axis of blood pressure regulation, the renin-angiotensin system we call it. And here this role of kidney becomes important. So the BP is regulated at multiple levels. What happens in a blood pressure patient, high blood pressure patient, that this system is dysregulated. The body is not able to sense an adequate BP, that the blood pressure is adequate, and in such patients, most of the time, the sympathetic system is like overacting. It is overstimulated, or what you can say that it's permanently stimulated. They are constantly stimulated to release hormones and certain signals that keep the blood pressure constantly high. And here is the role of renal denervation therapy, that it's very intuitive, that if you cut the feedback into the kidneys, that is causing the kidneys to overact and keep on releasing hormones like renin, you are going to control the blood pressure. And this forms the hypothesis, the basis and the logic how renal denervation therapy can work in patients who have high blood pressure. That is, you cut off that signal from the brain to the kidneys so that the adrenaline system doesn't stimulate the kidneys to release hormones which are directly responsible for a high blood pressure. And I think this explains how RDN works.
That's insightful, Dr. Vivek. Now, can you describe how renal denervation therapy is performed?
Okay, so this therapy sounds interesting. Okay, so how do we do this? How can we cut the nerves to the kidneys? This is very interesting. The best part is that there is no open heart surgery. So there is no open surgery. I am an interventional cardiologist, so we believe in doing things minimally invasively, that is through the arteries and the vein. And obviously you can guess that if if an interventional cardiologist is talking about RDN, it means that it is to be done with something which is not requiring an open heart, open surgery. So how do we do this? Anatomically, the renal nerves that our targets in RDN are there around the blood vessels of the kidneys. They are very close to the kidney vessels, the renal artery. And since there is a constant flow in the renal artery, the blood flows constantly, what we do is that we have access from the groin, the femoral artery. Through that, we go to the renal artery through a catheter, and there is a very special catheter that is meant to deliver radio frequency energy at the level of the renal artery. What it does is that this therapy, in this treatment, that through the arterial access, which is done under local anesthesia, so no general anesthesia is required, we go into the renal arteries, we take a radio frequency catheter, which is a very special catheter, and we deliver radio frequency energy in the renal arteries. What it does is that it doesn't damage the renal arteries, but the heat radiates around the renal arteries and they burn the renal nerves around the arteries. And this is how we do. We select the branches and the main vessel, main renal arteries on both sides. Some people can have accessory renal arteries, that is extra renal arteries. We target that also. So the procedure time can be about 1 to 2 hours depending upon how many branches are to be treated. That is how many nerves are to be cut through this process. So we don't actually cut it, we burn the nerves around the renal arteries. This procedure is done under local anesthesia. No open surgery is required. Some mild sedation is needed because sometimes some patients may feel some pain during the procedure. So we give mild analgesic, that is painkillers, and slight sedative so that the patient doesn't feel a lot of discomfort. But after the procedure, the patient can be discharged within 24 hours. And this is the beauty of this treatment. So in GIST, this process is done under local anesthesia. No open surgery is needed. We do a radio frequency ablation in the renal arteries. What it does, it doesn't damage the renal arteries, but it burns the nerves around the renal arteries. And after the procedure, the patient can be discharged the next day. So this was about in RDN, how we do it.
Dr. Vivek, how safe is the procedure?
Okay, so as I said that safety is very important. So a treatment should not be done just for the sake of doing. It's important that it impacts the patient positively. So whenever we do a procedure, we always do this risk and benefit analysis. And we don't offer a treatment which is riskier and the benefits are less. So for RDN, that is renal denervation therapy, I can tell you confidently that it's a very safe procedure. As I said that our targets are the renal arteries. We don't do anything else. So we do treatment in the renal arteries and it doesn't damage the renal arteries. So obviously we have to choose the patients. We have to screen the patient. We have to select the ideal patient. So if somebody is already having an issue with renal arteries, we don't do this procedure in that. What issues there could be? There could be narrowing in the renal arteries. There could be some dissection in the renal arteries. These can be acquired or congenital. So we don't treat in such situations because we need a normal renal artery to work. So it doesn't cause any damage to the kidneys. It doesn't cause any damage to the renal artery. Whatever complication happens, it's just the local complication. The puncture site, there could be some bleeding there because it's a major blood vessel that we are getting we are taking our catheter into as an access. So local complications could be there, that there could be some mild bleeding that could be managed. So overall, the risk is about 0.01%. So it's a very less risk procedure, and whatever complication happens, it just happens because of a routine angiography, whatever complication that happens in a routine angiography, that is local hematoma or bleeding, that's it. Otherwise, it's safe for the kidneys, and it causes any problem to the renal arteries also.
The next question on everyone's mind is renal denervation therapy effective, and is its effect durable?
And this is very important. So, as per the latest data, what we can say is that in about 80% cases, this therapy is going to work great. It's going to really reduce the blood pressure. And how much blood pressure reduction we expect? So overall, we expect that there could be a decrease about 10 to 20 mmHg in the blood pressures. This may be variable. We have patients who show dramatic improvement in the blood pressures. There are patients who show less dramatic or less significant reduction in blood pressure. It all depends the mechanism of the blood pressure to start with. So in patients who are going to respond, they are going to respond really great, and we are confident that about 80% of patients, they respond very well with this therapy. Regarding the longevity of the effectiveness of the procedure or durability of the procedure, so what we can say that as per the data that we have, so it's a new treatment, and anatomical studies have been done in animal models. So in them, what we see is that the nerves don't regenerate. So the treatment is based on cutting off the nerves, and if the nerves don't regenerate, obviously there will be no recurrence of the problem to start with. We have data that more than 3 years data we have now, and we have found that the blood pressure control is consistent. Yes, it will not result into complete normalization of blood pressure. What it will do is that in people who were having high blood pressure, not easily controlled by the medicines or medical therapy, in them it will be able to, the add-on procedure will help to reduce the blood pressure to the target level. So we were dealing with resistant hypertension and patient, and we were thinking that what to do to control the blood pressure. In such patients, this treatment will come as an add-on. So it is not the first treatment for blood pressure. It is as an add-on treatment for blood pressure management, and definitely there will be just some patients whom we can expect that there will not be any need of blood pressure treatment or blood pressure drugs after the procedure. But what we are confident is that in patients whom blood pressure control was not easy, or whom the need of multiple drugs were needed, in these patients it will reduce the pill burden, and additionally it will help to maintain a good blood pressure.
Thank you for clarifying that, Dr. Vivek. Finally, who are the ideal candidates for renal denervation therapy?
So this is very important. As I said, that it is not the first treatment of hypertension, that is high blood pressure. At best, it can be used, according to me, that what I can recommend is that as an add-on treatment in patients whom blood pressure control is difficult, that is resistant hypertension. So there are two types of resistant hypertension. One hypertension is in people who take the medicines regularly as advised, as prescribed, but the BP is not controlled. So they are like true resistant hypertension patients. But there are other patients whom you prescribe a medicine and they are not very diligent in taking their medicines. They are not punctual. Sometimes they take, sometimes they don't take. So in these two group of patients, I think renal denervation therapy can be used and should be advised, because what it will help is that it will help to control the blood pressure. Internationally, there are group of patients in various trials that have been found that they want it as a first line treatment. Yes, it can be offered, but yes, it needs to be discussed with the patients. That look, ideally this treatment is for resistant hypertension and people whom the blood pressure control is difficult. But yes, if you want that, okay, I don't want it to be taken a blood pressure therapy, which I don't recommend, so it can be discussed. So today medical therapy is changing. We are moving from advice to what I can say is that shared decision making. That is, it's not that as a doctor or a physician I advise a treatment and you take it just on my words. Today, in this generation of info revolution where everything is accessible, you can Google renal denervation therapy and you can get to know all the things about it, even something which may I have missed. So today the time is of shared decision making. That is, I give the inputs, you give your inputs, and we decide together that what is best for you. And I think RDN, we can put it into that category. Ideally, it should be used for treatment as an add-on in patients whom blood pressure control is difficult.
Thank you, Dr. Vivek, for sharing your insights and expertise on renal denervation therapy and hypertension treatment. It's been an enlightening discussion. Any last message for viewers?
So, it's very important to understand that hypertension is a problem which is very prevalent. Unfortunately, we don't go for regular checkups to get to know, so that we don't get to know our blood pressure. It's very important to check your blood pressures, and if it is found to be high, you need to be compliant with the advice of the doctor. Lifestyle measures are very important for blood pressure control, but it is seldom sufficient. And it's very important to take the medicines regularly. And yes, if the BP is not controlled, we have options in form of RDN, that is renal denervation therapy. Thank you so much. It was a great pleasure to interact with you. Thank you, Maitri.
Thank you to our viewers for joining us today. We hope you found this session informative. If you have any more questions or need further information, don't hesitate to reach out to your healthcare provider. We wish you all good health and well-controlled blood pressure. Thank you for being with us. Goodbye.